How to prevent and detect ovarian cysts in time. Ovarian cysts are a benign problem in some women. Even though they don't pose any sort of risk to health, it's best to treat them early on so as to prevent any future complications. This illness generally appears between puberty and menopause and is not very common after menopause. What are cysts? An ovarian cyst is a small, liquid-filled bag that forms inside or outside of a woman's ovary. These are formed when the woman is ovulating, during which time a small follicle in one of the ovaries forms, which then breaks when the egg matures and is ready for fertilization. After releasing the egg, the small sac or bag dissolves and disappears naturally. But if this does not happen, or if the sac fills after the egg has been released, then it could become filled with water and increase in size, thereby forming cysts. What causes cysts? A woman is at a higher risk of forming ovarian cysts if her menstrual cycles are irregular, if she is undergoing fertility treatment, as hormonal imbalances, as well as genetic factors. How to detect ovarian cysts in time. Ovarian cysts generally do not present any symptoms that could alarm a woman. However, there are a few cases in which some women can feel acute abdominal pain while doing certain activities. When a cyst bleeds or bursts, it produces an intense pain that should be tended to immediately, as it could cause vaginal hemorrhages. Another way of detecting them is when a woman feels pain before beginning her menstrual cycle, or during sexual relations. Other symptoms that could help detect ovarian cysts are nausea or vomiting, breast sensitivity, weight gain, urination problems, abdominal or pelvic swelling, pain in the lumbar region and thighs, combination of pain, fever and vomiting. If you have any of the previously mentioned symptoms, it is best to consult a specialist for a pelvic exam that can confirm ovarian cysts. If the doctor suspects this problem, he or she can prove it by performing an ultrasound or an MRI. Blood tests can also determine if the cyst needs to be removed or not. How to prevent ovarian cysts. In order to prevent the formation of ovarian cysts, you should keep certain recommendations in mind at home, which are easy to use. Follow a healthy diet. In order to prevent and treat ovarian cysts, it's best to include more foods that are rich in fiber and water so as to reduce abdominal pressure. It is also recommendable to include foods rich in vitamins and minerals, especially zinc, and vitamin B and C. Hot water compresses. If you feel abdominal pain, it's best to apply hot water compresses to reduce inflammation and to alleviate pain. Drink relaxing infusions. If you are experiencing symptoms like pain or abdominal inflammation, it's best to drink a chamomile, mint, or raspberry infusion. These infusions help prevent stress, they provide a calming effect, and are perfect before going to bed. Drink water. One simple and healthy habit like drinking water can prevent the formation of ovarian cysts as it keeps the body well hydrated. It is recommended to drink at least 8 glasses of water a day. Drink dandelion tea. Dandelion is known for its diuretic properties that promote liver purification, toxin elimination, and it helps improve hormonal balance. Keeping this in mind, this tea is perfect for preventing and reducing the formation of ovarian cysts. Exercise regularly. Exercising helps regulate the hormonal cycle, and helps prevent abdominal pain. It also keeps you healthy in every sense of the word. It has been proven that those who do physical activity tend to have less menstrual irregularities and they reduce the formation of cysts.